Bad breath or halitosis is the presence of a bad smell in the mouth that often does not disappear even if the patient has an excellent oral hygiene routine. Although it has various causes, 90% of the time it occurs when bacteria found on the back of the tongue break down food debris, blood, and cells, generating the production of sulfur compounds that cause bad breath. It is very uncomfortable since it can cause social embarrassment, both for the sufferer and those around them. It is important to mention that a significant percentage of people who have halitosis are not aware of this since their sense of smell can get used to the bad smell due to constant exposure and then stop perceiving it. Halitosis can be classified into three main types. 1. Genuine halitosis. It is when there is the presence of bad breath in the mouth. 2. Pseudohalitosis. It is when the patient claims to perceive a bad smell in their mouth, but when examining them, it is not found. This type of halitosis is psychological. 3. Halitophobia. It is the irrational fear of developing bad breath. It can appear in people who previously suffered from the condition and who have already been cured. Genuine halitosis can be subdivided into two kinds of bad breath: halitosis from intraoral causes and halitosis from extraoral or systemic causes. Intraoral halitosis represents 90% of all cases. It is produced by local alterations in the oral cavity, such as the presence of postnasal drip that falls on the back of the tongue, periodontal diseases such as gingivitis and periodontitis, the existence of cavities, dry mouth syndrome, or the consumption of tobacco or cigarettes. All these conditions allow the accumulation of bacteria that, by decomposing food, dead cells, or blood particles, produce chemicals with a strong odor, such as sulfur compounds. Extraoral halitosis occurs as a consequence of alterations in other parts of the body. These can be of respiratory origin, mainly caused by infectious or inflammatory processes in some part of the respiratory system, such as sinusitis. They can be of gastrointestinal origin as a consequence of conditions such as reflux and Helicobacter pylori infection, and it has even been associated with the presence of hepatitis. And finally, they can be of metabolic origin such as transient bad breath during menstruation, due to the increase in estrogen or the presence of substances with intense odors in the breath as a consequence of some metabolic syndrome. Some characteristic symptoms of halitosis are perception of an unpleasant taste in the mouth, sensation of dry mouth, presence of a whitish layer that covers the tongue, plaque formation around teeth, and red or bleeding gums. Although oral hygiene is extremely important and can help us keep a fresh breath, we must understand that this is not the only cause. You could have adequate oral hygiene and still have halitosis. It is important to go to the dentist for them to determine the cause, since this could be something as insignificant as a restoration in poor condition. The most frequent causes of halitosis are accumulation of dental plaque and tartar, restorations in poor condition, dental caries, gum inflammation, gingivitis, periodontitis, pericoronitis, bleeding in the oral cavity, bad breath from sore throat, xerostomia, obstruction of the nasal passages, sinusitis, tonsil stones, pharyngitis, smoking habit, high alcohol consumption, gastrointestinal disorders where stomach acid causes bad breath, consumption of certain medications such as antihypertensives, anxiolytics, antidepressants, and antiallergics. The treatment of halitosis is personalized and must be aimed at eliminating the cause. That is, if the cause is a problem in the oral cavity, said problem must be treated directly. If it is an extraoral problem, by treating said problem, the halitosis will improve. To immediately reduce stinking breath, the dentist can prescribe medicated mouthwashes to selectively inhibit the growth and proliferation of odor-producing bacteria. Among the best mouthwashes for bad breath, we have triclosan, chlorhexidine, and zinc chloride. In addition to this, it is necessary to adopt stricter measures in terms of oral hygiene routine, use the necessary utensils such as a toothbrush, dental floss, tongue scrapers, and, if necessary, use electric brushes and oral irrigators. There are also some effective home remedies for fighting bad breath. Rinsing your mouth with baking soda or salt water can reduce stinking breath and make your mouth feel fresh. You can also chew on some good-smelling herbs like mint, or even drink mint, rosemary, chamomile, or clove infusions, as all of these natural ingredients have properties that inhibit bacterial growth. Hydrogen peroxide is also efficient at fighting bad breath, but just in small percentages since using it directly on the gums could cause burns. Mouthwashes for halitosis contain hydrogen peroxide at a safe percentage that is harmless to the oral mucosa, plus other substances that help to get rid of bad breath. Please do not use hydrogen peroxide as a mouthwash. It is best to buy a specific mouthwash for halitosis. You should also avoid some reckless practices like taking antibiotics to fight bad breath. Antibiotics are not effective against a stinking breath. They can actually make the situation worse. It is best to use antiseptic mouthwashes for bad breath such as chlorhexidine or triclosan. Some foods like alcohol, coffee, garlic, onion, milk, and spicy foods can cause or worsen halitosis. Although this is usually temporary and disappears after performing a correct oral hygiene routine, you might want to avoid them for a while, at least until you get rid of your halitosis. Now let's talk about halitosis in babies. Bad breath in babies usually occurs temporarily and naturally, while the first teeth begin to erupt because the gums become inflamed and sometimes bleed. It can also occur if the baby is dehydrated and has a dry mouth, or if proper oral hygiene is not carried out after feeding them. This is done by cleaning the baby's gums and tongue with wet gauze or with a special baby brush. However, a stinking breath can also occur as a result of an infection in the mouth, throat, or respiratory tract, as well as gastrointestinal disorders such as reflux. So if your baby's bad breath does not disappear on its own in a few days, we recommend you go to the pediatrician or pediatric dentist to get a proper diagnosis. There are some situations in which adults having bad breath is perfectly normal and is not a reason to worry, for example, when you have halitosis after waking up. The cause of morning breath is completely natural because during the night our salivary glands decrease their activity and salivary flow is drastically reduced, causing the mouth to dry out and bacteria to accumulate. You can reduce the bad smell when you wake up if you use tongue scrapers before going to sleep. This is it for today's video. Thanks for watching. Like and subscribe for future oral health videos. Till the next time.